I'll give you a brief introduction on who Best Buy Health is. You may not be familiar with Best Buy Health as an entity. We'll walk you through the broker affiliate program, the details on how to sign up, the discounts that the members will receive, and the commission that you'll get on the back end. And then we'll give you a kind of step-by-step instruction on how that process all works. And then, as Beth mentioned, we have Q&A throughout the presentation. If you type them into the chat, we'll be able to get to those as well. So you may not be familiar with Best Buy Health, but you're likely familiar with Best Buy. So we are the consumer electronics retailer that you know and love, really combining the technology with human support. That's really at the core of who Best Buy is, whether it's in the stores, whether it's through Geek Squad agents coming to your homes, whether it's through our call center agents fielding questions on the phone. It's really that combination of tech and touch. About 7 years ago, Best Buy really had that hypothesis that care was moving to the home and that technology was going to play a larger and larger role in people's lives. So we entered into the health space and formed Best Buy Health. At the center of that is really that senior population. There's a lot of technologies out there that can help people stay independent and safe in their homes. And we want to be the ones that bring that to life, whether that's direct to consumer, whether that's through different insurance programs, whether that's through senior living programs. We have relationships across the board where we help members depending on where they are. Our purpose is to enrich and save lives through technology and meaningful connections. And our goal is to enable care at home for everyone. So as we look at our purpose, we don't take that lightly. As you can see, it's a combination of technology and meaningful connections. That could be a connection between a senior and their caregiver. That could be a connection through between the senior and our customer service agent. That could be through the senior and our Geek Squad agent. But it's really about enabling those meaningful connections, again, to help people stay safe and independent in their homes. Who we serve today, we have about 1 million members on our services already. And what are those services, you may ask? Our primary service is the personal emergency response device. We also carry senior-friendly cell phones under the Jitterbug brand that you may be familiar with as well. We have about 100 health plan customers. So some members are able to get the services from their Medicare Advantage plan, from Medicaid waiver programs through the state. And then we also have relationships with senior living communities where members or residents get access to our services in their communities as well. Now I'll dive a little bit into the broker affiliate program. Where this all started, it was through conversations that we had with the broker community about 6 months ago. We were at a conference called Medicarians, and we were there promoting the personal emergency response device through our partnership with a few of our Medicare Advantage customers. And as we were talking to brokers, they were mentioning that there were some large health plans in the space that had recently dropped the benefit, and they had chosen not to pay for it or reimburse the personal emergency response device for those members any longer. There was also members who are in plans that don't qualify for the benefit. Maybe that's a Medigap coverage, or maybe that's traditional Medicare or different dual eligible plans. And they said, hey, we have members who could really use this service, but there's not a great way for them to be aware of it. They're not getting it through their health plan. Is there a way that Best Buy Health can help my members? Because they still need They still need PERS. They need a cost-effective way to stay safe and connected in their homes. So that was really the impetus of this program. How can we help those members who don't have it covered through their MA plan or through other means? So we developed the broker affiliate program. So how does the program work, and really what does it look like? At the crux of it, what it is a discount for members to sign up for a PERS device and PERS service through Best Buy Health. What's in it for the members? Obviously, the industry leading service and support at a discounted rate. What's in it for the brokers? Well, it's a way not only to help your members and to provide them with a service that's going to help them stay safe and connected in their homes, but also provide you an opportunity to make some extra referral money on the back end for every member that signs up for the program. How it works today, and as Beth mentioned, there is a startup guide in the attachments to this webinar that you can view that has detailed instructions of how to sign up and register on the site that we're using. It's called CJ, and they have an affiliate portal where you will register, sign up, complete the information. From there, and I'll dive a little bit deeper into the actual sign up process here in a second. From there, you'll receive a unique link, a unique URL. That's going to be the key for you to use for members to access the sign up process for our services. So the member or you helping the member will be able to click on that link. It will go to our website, where the member can view the different plans that are available for PERS. They can choose if they want fall detection, if they don't want fall detection. There's several different plan options for them to choose. And then once they sign up for the service, that's what triggers the $25 referral payment back to you. So we're really excited about the process. We think it's pretty seamless for yourselves and for the members. And once you sign up through the CJ site, it's really then pretty downhill from there. I will back out of the PowerPoint for a second, and I will walk through the startup guide. So again, as Beth mentioned, this was included in the email that was sent to you, and it's also included as an attachment in the webinar. So this is the first step in the process to get signed up, and this is really the most important part. We've taken a lot of time and thought into putting this startup guide together. So it's really important to look at this and follow the instructions to set up. So there's some initial information here about the program, about how it's structured and why we're doing it. But then really the most important part is getting set up on the CJ site. So you'll see included in this is a link to click on, which will take you right to the CJ site. From there, it's simply a matter of following the step-by-step onboarding checklist. So after you create an account, you'll log into that account, validate your email, enter your user information. There's gonna be a few things that they ask you to set up, and we've included exactly what to type into that setup process. So they'll ask for a property setup, which again is just a terminology that CJ is using for this program. You follow the step-by-step instructions on what to put into your description, what to put into your promotional model, and how to name your property, and then finally to finalize setup. Once your account is activated, you'll have to log into your dashboard and sign up for the Best Buy Health affiliate program. So you'll follow the instructions, click on the apply to program. What will happen there on the back end is it'll have to be approved. So it'll go into our back end approval process. It should take no more than 24 or 48 hours for us to approve. Once that happens, you'll get that referral link that I talked about. So that referral link is specific to you. It's unique to you. And using that link is what ties the referral back to yourself and how you get paid. So if the member goes on, so Lively is the brand that is the personal emergency response band. If the member were to go onto lively.com themselves and sign up for it, that referral will not get tracked to you and you won't get your referral bonus. So it's really important for all signups to be funneled through your specific referral link. So that's what it gets tied back to you and gets paid through the payment mechanism that you choose. If you run into any questions or problems throughout the process, we are here to help. As I mentioned, this is a completely new offering and new program for ourselves, so we know there's going to be questions. You can direct those to, if they're technical CJ questions, you can direct them to Maria Hernandez. If they're program-related questions, you can direct them to Lily Sanchez. She's on our team, and she'll get back with you on how to solve that question. We'll be very quick to resolve any questions that you may have. So we want to be there to support you throughout every step of the process. I'll jump back to some of the commonly asked questions that we've run into. So, one of the questions is, who should I refer? I have a lot of members in my book of business. Who are the ones that I should refer? The ones that are most suitable for this are obviously ones who have, at the highest level, who have a need for personal emergency response services. Your members, their situations, the ones that may need a little extra safety net at home. They may need that connection to our services. They may live alone. Those are really the members who are best suited for this type of service and who don't have it paid for through their plans today. So as I mentioned, a lot of plans have recently dropped it from their supplemental benefits. So if they're part of one of those major carriers who dropped it, but they still need that service, those are the members who are going to be the ones best suited for the program. So if you refer a client, so for example, we have Best Buy Health is the PERS vendor for Anthem and WellPoint plans. So if you have members who are part of an Anthem plan where it's currently already covered and they sign up through Anthem, that's not going to be a member who qualifies for the referral payment in this program. It's for members who don't have it as a covered benefit. What happens after I refer a client? So, as I mentioned, how you refer a client is having them click on your unique link, taking them to our lively.com page where they're able to shop and select the plan and the device that's right for them. After they sign up for the service, they're going to begin, they get the device usually within a week or so. That's when they're now a member of the Best Buy Health PERS service, and you have successfully referred a client. There is then a payment. So the next question, how do I get paid? You have completed all your information on the CJ setup process. So completed your payment instructions. The member has signed up through their specific link. That will then trigger a payment to you in the form of $25 for every member that signs up. Generally, the payments are made around the 16th of the month, so they're made monthly. So we'll track how many members you've signed up, and you'll get a lump sum payment typically around the 16th of the month. Another question that we have gotten is, what happens if my member signs up for the service and they find out it's not right for them and they cancel the next month? Do you claw back my referral payment, or is there a minimum threshold with which the member has to be on service? The answer is no. You get your referral payment regardless of how long the member stays on service. The registration through the CJ process should take about 10 minutes, following those step-by-step instruction guides. And again, if you run into any questions or any problems, please reach out to Lily on my team, and we will help you through every step of the way. This is what, when you click on that link within the startup guide, this is what it's going to take you to. And again, it's pretty self-explanatory if you follow the startup guide on how registration works. So the resources that we have available to you, I mentioned the startup guide. That's going to be for you specifically. So that's a broker-facing piece of material that's really more around the background of the program and how to sign up for the CJ process, how you get paid, really kind of back-end logistics. We also have a client-facing flyer. So as you're talking to your members and explaining the value of PERS and specifically the value of Best Buy's PERS, this is a piece of collateral that you can use and share with them. So, as you're probably aware, there's a lot of PERS vendors out there. This is really just touches on a few reasons why Best Buy Health is unique. So, we hear a lot about cost being a factor, right? Like clearly, if somebody's paying out of pocket for their services, we want to make it as affordable as possible. So our plans start at $24.99 per month, which is one of the lowest, if not the lowest in the industry from a monthly standpoint. We also have the fastest urgent response time when the member pushes their button. So you can imagine if you're in a situation where you need help, you push that button, you want response as quick as possible. Somebody on the other end of the line talking to you and helping you through that situation. And for our service, that's within 7 seconds. You're going to have a human on the other end of the line talking to you. We also have fall detection available as well for an additional $10 per month. That is a specific fall detection algorithm that's unique to Best Buy Health that is tested to be the most accurate in the industry. I mentioned, the member is going to get 50% off. So they get 50% off the price of the device. So whatever the current price of the device is at the time, the member will get 50% off that price. So if it's at full price, they'll get 50% off. If we run from time to time, we run sales and we discount that device, they'll get an additional 50% off of the price, even if it's discounted already. And they just have to put broker 50 into the promo code spot during the checkout process. We also have some additional resources that are in the works. We have an email that will distribute out that can be used for you to send to your members. We have some social media that can be used to distribute the information. We also have a specific landing page for this program as well, where all these resources will be available to you. As an attendee for this session today, you're also eligible for the team. So please reach out to Lily Sanchez and we can get that scheduled. We'd love to walk you through, your specific situation, walk you through a bit more detail of of the program and answer any questions in a one-on-one setting. So I went through a few of these examples, but one of the things that we really take pride in is how is our service and how is our offering different from others that are available in the space. So if you are familiar with PERS, most people are familiar with it as something that can be used in case of emergencies, and that's certainly what we strive to do is help people in case of an emergency. How the device it works, it has a cellular chip in the device itself, connection to our caring centers. There is two-way talk and listen right through the device itself. So you can see there's a speaker and a microphone on the device. So when you push that button, within 7 seconds, you're going to have a Best Buy Health representative immediately talking to you through the device. And the member will be able to talk back through the device as well. So we'll triage the situation and determine what that best course of action is. That could be dispatching urgent response. That could be calling a caregiver that we have listed on file. That could be just staying on the line and talking to somebody who might be lonely or anxious in the middle of the night, and they just need support and that human connection. The device does have GPS outside the home or inside the home. So if the member could be out on a walk or out driving, they could be lost or they could need help. If they push that button, we're able to know where they are so we can send help directly to them. The battery typically lasts, it has about a 36-hour charge. The device comes with a cradle charger, and that charger takes about 3.5 hours to charge from 0 to 100. So we recommend charging it for an hour each day, and it will stay fully charged. It is water resistant, so the member can wear it in the shower with no problems at all. I also mentioned the optional fall detection technology that is available in the device as well. I walked through these again. These points are on that flyer. Again, as far as the price per month, it is the $24.99 per month, and the member gets 50% off of the price of the device using the broker 50 promo code. If you have any questions throughout the process, we're here to help and support you. If there are technical questions on the CJ side of it, those can be directed to Maria Hernandez. If there are program questions, those can be directed to Lily. I would say if you're not sure, direct the questions to Lily. We'll be able to help you sort through any of those questions that you may have and get you the answers you need. As I mentioned, please reach out to Lily to schedule a one-on-one session, and we can go into more detail, more support. But again, we are really excited that you've joined us on this call today. This is a way for us to help those members that need that extra support and connection in their homes, and also a way for you to help your members and earn some extra money through the referral process.
Wonderful.
So I will stop sharing. Beth, I'll maybe open it up to you if there's any questions that have come through the chat.
Yeah, thank you, Scott. And thanks to everyone on the line who joined. I know a few of you joined a little late. We did record the whole session, so we'll share out the whole recording in the day or two following this. But we did get one question come in, and if anyone else has any others, please type them into that questions box, and we'll have Scott answer anything you may have in the few minutes we have left. Scott, there was one question that said, what happens if my client signs up and then a month later they cancel? Do I still get a referral bonus?
Yeah, so the answer is yes. So as soon as the member goes through the checkout process, they are considered a enrolled member and you are eligible for the referral bonus. So even if they're only on a month, even if they're only on a day, you are eligible and will receive the $25 referral bonus. Now, as I mentioned, the processing with CJ, from what we've heard from them, it typically comes on around kind of the 15th, 16th of the month. So, and it comes in one kind of one lump sum payment. So you should see that referral bonus come through. If you have any questions on you're not seeing it come through, hey, I've referred 10 members, they've all signed up, I'm not seeing, my payment isn't accurate or I don't see it coming through properly, please reach out to us and we will sort through that. But to answer the question, yes, you will receive your referral bonus for any members that sign up. The other thing that I'll mention too that goes along with that is we often get questions because we have competitors in the space who think about things differently than we do. Is the member locked into a contract when they sign up for the service? The answer is no. There are some PERS vendors out there who require members to sign up for 2-year contracts, and they are, we know firsthand because we hear from them a lot, the contracts are very, very hard to get out of. At Best Buy Health and through our Lively product, we do not require any long-term contracts or agreements. So members can stay on for as little or as long as they need and require the service.
Great. Thanks, Scott. I think we have one more question unless anyone else has anything else. That question is, what happens after I refer a client? So can you just walk through kind of the process from the referral on?
Yeah, so the client, how to refer a client is through that unique link, that unique URL that you're going to get after signing up through CJ. So the client, a referral will be when a member clicks on that link, or it could be you could be meeting with your member during AEP and help them click on the link or show them the link right there. So it could be done you sending the email to them, or it could be done when you're sitting right there with your client. That link will go to the lively.com website. So again, Lively is the name brand of our PERS service. So clicking that link will go to the lively.com website. That's where the member will have to make a few selections. So there is a choice between a couple different plans. So the basic plan at $24.99 is it includes personal emergency response. It includes 24/7, 365. It includes access to our customer support team. We call that our 5-star our 5-star team. That includes access to support for caregivers. So caregivers can be a part of the care circle of that member. There is an upgraded plan that includes a few more things. It includes a nurse on call service. It includes a social care type of service as well. So that's a additional $10 charge. And then there is a choice between fall detection or no fall detection. So the member will have to make a couple different choices on basically which plan do they want, and do they want fall detection or not. After they make those choices, they go to the checkout experience, and in that checkout experience, they put in the broker 50 promo code, so that will give them then 50% off the device fee. And once they start and click submit, that will process an order for us. Those orders are fulfilled usually within 7 days. The member will have that device shipped out to them. The device comes ready to go out of the box. We do recommend that the member, when they get it, they push the button. They make sure that it's working. They make sure that they're comfortable with it, and that that there's no issues. But that device comes out of the box ready to go. They're able to set up on the back end. They're able to set up their profile as well by pushing the button and speaking to our care team. They can include information like their caregivers, their family members, who they would like called in case of an emergency, so they can relay that information back to our care team. They can even mention things like, I have a key hidden under my welcome mat. So if there's an emergency and the fire department or police or EMS needs to get in, that's where the key is, so they don't they don't break down my door. There's information that can be relayed to our team, included in the member's profile. So that's really kind of the setup, the setup and sign up process. And again, once that member signs up using your unique link, that's what's going to trigger then the $25 that's paid to you.
Great, thanks, Scott. I think those are all the questions that came through today. Like I said, the recording will go out after this. The 2 handouts are in your panel right now on screen, but we also sent them in the email. If for some reason you don't have them, reach out and we could send them again. Scott, any parting words before we wrap things up?
Yeah, the one last thing I'll mention is, we know the broker community. We work a lot with the broker community through the Medicare Advantage plans that we currently serve. We know it's a close-knit, tight group. We've tried to get the word out on this program through emails. We're going to do some social media. But if there's others that that this program might be beneficial to, please pass the information along to them or send them our way. Provide them with Lily's contact information. We'd love to spread the word on this program. We think it's a great opportunity for you guys to earn extra money, and great opportunity for the members to sign up for a great service. So please spread the word, and we'd be really grateful for you guys to do that. And I'll just close with, thank you so much. We are appreciative to all that you do for serving this population. These are members that we are passionate about. We strive to provide a great service at an affordable price to keep them safe and connected in their homes. So we really appreciate all that you do for these members.
Great. Thanks, everyone.
Thanks.